Hey guys! Welcome to Unit 3 in Psychology of Aging. In this lesson today, we are going to be talking about pneumonia. Have you guys ever suffered with this infection or known someone who has? Have you ever wondered how it's affecting your body? Well, today I'm going to be going over what exactly pneumonia is, the causes of this infection, the ways to prevent it, and the different ways to treat it depending on the cause. And I'm also going to address how common it is to get this infection, and specifically how susceptible people are to get this infection at age 65 and older. So what exactly is pneumonia? If you have already suffered with this infection or known someone who has, you may have an idea about what it is. Pneumonia is an infection or inflammation in one or both of the lungs. It causes the tiny air sacs, known as alveoli, to fill up with fluid or pus, which can make it very difficult to breathe. If the alveoli becomes infected, it makes the lungs less effective and reduces the amount of oxygen that can be taken in. Symptoms for this infection can range from being mild to severe. The other symptoms associated with pneumonia can include a cough with phlegm, fever, and chills. So what are some of the common ways of getting pneumonia, or what exactly causes it? There are 3 different germs that can cause pneumonia. The first one being bacteria, which is the most common. The most common bacterial infection is called Streptococcus pneumoniae. It is most common for people to get this right after getting the cold or flu, and it usually only affects one part of the lobe or one area of the lung. Another way to get pneumonia is through fungi. It can occur in people who have weak immune systems due to HIV or AIDS, or the long-term use of medicines that suppress their immune systems, such as those used to treat cancer or transplant procedures. Another way to get a fungal infection is through soil that is found in some parts of the United States. And the last way to get pneumonia is through a viral infection, which can be viruses that infect the respiratory tract and lead to causing pneumonia. The influenza or flu virus is the most common cause of viral pneumonia in adults. After hearing the causes, a following question may be, how do we prevent or how do we steer clear of getting this infection? Well, some ways to prevent getting pneumonia include getting vaccinated, taking care of your immune system by eating right and exercising. Make sure you are getting enough sleep. Try to quit smoking if you already do, and just by having good hygiene. Since this can lead to be a very serious infection, it is very important to make sure you are doing these things and always to make sure you are taking care of yourself. If you or someone you know ends up getting pneumonia, just know that there is a way to treat this infection. Getting treated for pneumonia depends on what pneumonia you have, how you got it, and how severe it may be. All 3 causes can be treated with medication of some sort, but they all differ on the amount of time it will take to start feeling better. For bacterial pneumonia, you will get treated with antibiotics. People tend to start feeling better in as little as 1 to 3 days after, but still should take their medication until it is all gone. For fungal pneumonia, antifungal medications are used for this. And for viral pneumonia, antiviral medications are used to treat this, and you will improve within 1 to 3 weeks. So now that we have the tools to know how to prevent it and how to treat it, can we still be at risk for getting this infection? How common is it for people to still get pneumonia, even if they are taking high measures to prevent it? It is most commonly seen in adults aged 65 and up because that is when their immune system starts to weaken. It can also be seen in infants who are 2 years old or younger because they haven't built a strong immune system yet. And lastly, it is also known to be more prevalent to those who are exposed to someone who already has an infection because it is easily spread by direct contact. As we age, we become more susceptible and more vulnerable to certain illnesses and infections. In this case, people over the age of 65 are at higher risk of getting pneumonia. This is because our immune system starts to weaken and we cannot fight off the infection like our body normally would have. This is considered a normal part of aging. Pneumonia is actually known as the second most common infection seen in adults 65 and up, mainly because there is a high chance of getting it right after getting the flu or even the common cold. And lastly, the elderly have a lower ability to produce a strong cough, and coughing helps expel harmful things in the body, such as germs that can cause pneumonia. All right, class, now as we bring this lesson to an end, it is time to ask a few questions. The first one is, what is the most common way of getting pneumonia? The second one is, what age groups are at high risk for getting pneumonia? Please pause this video and write down your answers. The answer for the first question is, the most common way of getting pneumonia is through bacteria, especially after fighting off the flu or the common cold. And to answer the last question, it's 65 years and up, and 2 years or younger are the two age groups at high risk for getting pneumonia. After today's lesson, I hope you guys have a better understanding of pneumonia and learn some new facts about it. I'm excited to learn about the new topics that are in Unit 3.